Okay, this recording, let's start at the herpes simplex. These lesions usually occur on the lip. This is what we will see in dentistry. But sometimes patients that have a compromised immune system, the lesions can occur throughout the mouth. Sometimes an ulcer caused by herpes can persist for longer than a month. That might be an indicator of a person that may have AIDS or HIV positive. So you want to take a look around the mouth and check to see if you see anything abnormal, or if they mention an ulcer, you need to mention that to the dentist and let them take a look. Herpes simplex should clear in 7 to 10 days with or without medications. If it extends longer than a month, then that might be a red flag as an indicator. So sometimes you have to be a little bit of a detective and ask the patient questions if you see these type of lesions in the mouth. This is a picture of someone that is HIV positive. You see a herpes simplex ulcer on the palate. If you notice the peripheral borders, this is very large. So this shows that you just need to take time to slow down, stop, pick up a mirror, and just take a look around at the tissue. And if you see anything abnormal, or if a patient mentions anything, then you need to point that out to the dentist. Okay, here we're going to talk about the human papillomavirus, which appears most commonly in patients, again, that have immune systems that are compromised. The diagnosis can be made on appearance and biopsy findings. The lesions are commonly found in patients with early HIV infections, and these warts appear spiky, and some have a raised cauliflower-like appearance. So let's look at this lesion here on the upper lip of the patient. This patient is HIV infected, and we look at these little lesions here. Now this looks different than a fibroma. It looks different than other types of lesions. It looks different than a mucocele. So if you notice any type of lesions like this, we need to be very careful and very suspicious in talking to the patient and gathering information about how long it's been there, what appearance it has. I'll point that out to your dentist unless they've already seen it. Be sure you're taking a look under the lip and around the lips like this. Okay, so that ends all of the oral pathology. Now let's look at some dental developmental anomalies. These are things that you may see to do with the teeth that may come with the development. So these disorders can result when there's a disturbance of the cells during the period when the cells divide. The result is usually a deformity of part of the body. So just different developmental disorders when the cells, the amelioblast, odontoblast, and all may be developing. Inherited disorders are different from developmental disorders because they are caused by an abnormal gene. So a congenital disorder is one that is present at birth. It can be either inherited or development. However, the exact cause of most congenital abnormalities is unknown. The genetic factors are malformations that are often the result of genetic factors such as the chromosome abnormalities. Okay, this slide is on teratogens, which is an environmental factor, includes infections, drugs, and exposure to radiation. These factors are particularly critical during pregnancy. So think about the cleft palate and lip. The cleft lip results when the maxillary and the medial nasal processes fail to fuse. So in other words, when you think about the maxillary palate, and you think of it closing in shelves like we talked about way back in orofacial anatomy, this is the process fails to fuse together. So the cleft palate results when the palatal shelves fail to fuse when the primary palate, and then the cleft uvula is the mildest form of a cleft palate. With or without the cleft palate, it occurs in 1 of 2,500 live births. So it's unusual, but yet almost has a little bit a common thing, but here in the States we do not see this very often. We might see the result of surgery, but it's not something that we have to deal with here in the States. It is often associated with other significant medical and dental developmental issues. So here's a newborn with a bilateral complete cleft lip and palate, not severe angulation of the premaxillary segment. So if you look here, you see how the shells did not come together and form, and of course the nose also, we have a developmental issue there. Here's a cleft lip and cleft palates. As you can see, this child has the cleft lip here, which this is very minor and typically can be fixed, but as you notice, it's affected the nose also. And of course, this one is very little more extreme here. Okay, so disturbances in tooth development. We have abnormalities in shape, sizes, numbers, locations, enamel, and dentin. So let's look at some of those problems. We've talked about the pegged teeth before, pegged laterals. That's an abnormal shape. The teeth appear undersized, usually smaller. Permanent teeth do not form fully, and the tooth formed from fewer cells than normal. So that's what causes it to be pegged and shaped differently. So here we kind of have pegged centrals, which is a little more unusual than the pegged laterals. And here we have the pegged laterals. So it's a developmental issue with the teeth. This is severe. This is a case that you're probably gonna see in your career. This would be more maybe in a specialty type situation. Okay, so abnormal sizes of teeth. You have macrodontia is abnormally large, and microdontia is abnormally small. You have dens and dentae, which is a tooth within a tooth, that results in the formation of a small tooth-like mass of enamel and dentin within the pulp of a tooth. So dens and dentae is like a small tooth that develops inside of the pulp canal of a tooth. So macrodontia, microdontia. This is macrodontia. This is abnormally large teeth. Then microdontia, abnormally small teeth. So you have the centrals here being normal size, and everything is on each side is very small, and here you have two very small central incisors. Now what if you have an abnormal number of teeth? Supernumerary teeth are teeth that are in excess of the 32 normal permanent teeth, usually dwarfed in size and perfectly formed, but there's more than 32. Antodontia is the congenital absences of teeth, so the tooth is not there because it is congenitally missing. A partial antodontia refers to specific teeth missing. So maybe you have a maxillary lateral incisor that's missing, or mandibular premolars are the most commonly missing. Okay, so here we have a radiograph showing unerupted supernumerary teeth. Remember, supernumerary in excess of 32. So this person may have 35 teeth. So that's in excess of what we consider the normal 32. So here you have, here's one here and here. So they have supernumerary teeth. Supernumerary central. Here you have central, central, and a central in the middle of it. And if you look at the radiograph, you have the two centrals. And then you have this third central right here that it's showing. Now obviously this one is in the mouth, and this one has not erupted into the mouth yet, but it is there. Okay. Multiple supernumerary teeth. So you have two centrals there, you have two centrals here. Okay, so antodontia, gently missing teeth. So here you have the laterals are missing. That's the teeth that are generally will be the one that are congenitally missing. Will be the maxillary laterals, not the mandibular. Okay, so you have congenitally missing premolars here. And obviously we're looking here at a panorex, and this is what the dentist does. They go around, they count primary, then they come back and they count the permanent. So an abnormal location, dens and dentae, a tooth in a tooth. So the tooth becomes non-vital and it's diagnosed radiographically. So obviously something the dentist cannot see without a radiograph. So right here you have some enamel and dentin that's forming like a little tooth inside of the tooth. You have it here, and then you have a little bit happening right here. So that's what that is, dens and dentae, tooth in a tooth. Okay. All right, so enamel and dentin disturbances. So what can cause that to have formation problems? Well, amelogenesis imperfecta is a hereditary abnormality in which there are hypoplasia type defects in the enamel. Hypocalcification is the incomplete calcification or hardening of the enamel. And then you have hereditary enamel hypoplasias, a type of amelogenesis imperfecta that is characterized by teeth with crowns that are hard and glossy, yellow, and cone-shaped. Let's go back to this one just a second. So that's different things that you have in the enamel formation. Amelogenesis imperfecta, hypocalcification, and then hereditary enamel hypoplasia. So tetracycline discoloration, we've talked about this before. That's an intrinsic stain. So as you can see, the gray band across here. You also see tetracycline staining here. This is pretty normal. And then this is extensive. And more tetracycline. So obviously it's in stages. This is called fluorosis. This is a hypocalcification of the enamel. This is where the person's been exposed to too much fluoride when the teeth were developing. Then ameloblastoma is a rare benign tumor caused by remnants of the dental lamina, the cells that develop into the enamel. Symptoms include facial deformity, swelling, or numbness of the jaw, often from the third molar area. So this is ameloblastoma, and you can see it here in the radiograph, and then you see this large area here, ameloblastoma. Okay, in this image you'll see a loss of enamel in patients that have hypocalcified amelogenesis imperfecta. So you see the loss of the enamel here, the chipping away. Dentiogenesis imperfecta. Again, the dentin and the enamel do not form correctly. Abnormal eruption of teeth, a premature tooth that's present at birth, called a neonatal teeth. These are erupt within the first 30 days of life. Okay, this is ankylosis. So it's when the primary tooth is ankylosed to the bone. It's fused to the cementum and the dentin, and the primary tooth will not come out because it's really grown into the bone. So the dentist would have to remove that. It will not shed on its own. So this is the type tooth that we're thinking about. Okay. So an impaction, this is when a tooth is impacted, either in tissue or bone, and it cannot erupt. And obviously this one is in bone and is headed in the wrong direction for it to erupt. So an impaction.